This program is brought to you by Stanford on iTunes U at Stanford University. Please visit us at itunes.stanford.edu.
My talk is going to be about the big picture of maintaining health, and this is a talk that's I'm really happy to present because I think it's a very important area, and we need to all focus on maintaining health throughout our lives, not only as young people, but also as we get older. My objectives through this talk today is to have you appreciate the importance of exercise, healthy diet, and maintaining health. Also, I'd like you to be able to make informed decisions about getting a particular screening test and appreciate the changes that happens through our body as we get older and how they affect medications and metabolism in general, and also to understand the meaning of home safety and the importance of really maintaining health throughout lives and maintaining functional status. When did we start? I guess a lot of us, or some of us, have read the epics of Gilgamesh. That was written about 5,000 years ago. And essentially, if some of you know the story, Gilgamesh was seeking the essence of life, and when he found it, he took it and stayed it with him, but as he fell asleep, a snake came and stole it and never found it again. So I think today we are all seeking to find this snake that stole this essence of life. These are some possible scenarios for future morbidity and mortality. The first one presents really the current scenario. As we see, most of us gets an onset of an illness that's a chronic illness at around the age of 55. Let it be coronary artery disease or renal disease or diabetes. And we usually tend to live with this illness until the onset of death. Future models, the one model is actually by extending life. So we still may have the onset of illness around the same time, but we just live with it longer. And that can be achieved essentially by medications and certain tests. However, what we are trying to achieve, hopefully, is to shift the entire curve to the right. And by doing so, we delay the onset of an illness by a few years, hopefully. And by doing so, we live a healthier life longer. And by that, hopefully, we can also extend life. And this is really the perfect model, I say, is to compress the morbidity. Is by that, essentially, trying to have the onset of illness at a much later years in life, and then to live with it much less. So having better quality of life overall. I'd like to emphasize to all of you that the geriatric population, the elderly population, is a very, very diverse group of people. You may see the 85-year-old person who is jogging on the street and a 60-year-old person who is essentially disabled and frail and cannot really perform much. The main distinguishing factors in this diverse group is the functional status. And I would really like you to all pay a lot of attention to this. So functional status is really of paramount importance in maintaining a person's health and quality of life. Another things that determine how a person is doing is essentially the presence of comorbid conditions. What I mean by that is the presence of either coronary artery disease or diabetes, renal disease, lung disease. That also impacts the person's not only survival, but also quality of life, and also the presence or absence of a geriatric syndromes. And what I mean by geriatric syndromes, essentially and illnesses that are specific to the geriatric populations, which include either urinary or stool incontinence, mild cognitive impairment, dementia, depression, and functional decline or lack of ability to do basic activities of daily living. This is a slide. It's not meant to be dealt with in great detail, but what I wanted to emphasize through this slide is that this was a study actually done at the East Boston Senior Center, where they looked at actually more than 5,000 men and women, and they gave them essentially questionnaires and asked them to rate their health condition on a 4-point scale from excellent to good, poor, fair, and poor. And they followed those patients for a few years, and they looked at their survival rate. And so patients who rate their health as excellent, if they were on 65-year-old, they actually had a survival rate of a person who was 58, meaning they actually, their physiologic age essentially was an age of a 58-year-old person, as opposed to 65. And this was actually very true across the board. So a person who rated their health as poor, they had a survival rate of a 73-year-old if they were 65. So this is the chronologic age of the person, and this is what we call the physiologic age, meaning how long they survived based on their rating. So this is very interesting because I think it reflects that if you have a state, your state of mind really does matter in your survival. So it is very important to have a healthy outlook and have a good perception of your health. There are 3 main players in health and illness: lifestyle, genetic factors, and environmental factors. I guess we have very little control, or no control, over genetic factors. That's what we were born with. We have very little right now control over environmental factors. Hopefully, in the future, there will be more awareness of what's going on. And then we have some control over lifestyle, and that's what I'm going to try to talk about tonight. So just going to give you some statistics. Actually, less than half the United States adult exercise adequately. And what we say by adequate exercise is essentially exercise that would be cardioprotective in general. And then about more than a quarter of U.S. population doesn't even do any exercise. Again, about 2/3 of the United States adult population is either overweight or obese. And as we know, currently smoking is the leading cause of death. However, if the current trends continue, obesity will soon be the leading cause of death. So why should we care? This was actually this was a statement made by researchers at the Center of Disease Control and Prevention, and they found that about half of all deaths in the United States can be attributable to preventable illnesses or preventable behaviors. And those behaviors are essentially diet, obesity, lack of exercise, and tobacco use. So this is the current leading causes of death in women. And as you see, actually, cardiovascular disease remains to be the leading cause. However, we're actually probably seeing a significant decline in the cardiovascular disease incident with mortality. And the second line represents incident of cancer, cancer in general, overall cancer, as second leading cause of death. And then the third line represents stroke, fourth line represents chronic pulmonary diseases, and the last represents Alzheimer's disease. And this is in women. For men, it's about the same, with the exception of acute pulmonary illnesses as being the fifth leading cause of death. So what's a healthy lifestyle? It's a difficult question to challenge, but I believe maintain healthy social life with family, friends, grandchildren, be active every day, eat well, avoid tobacco and excess alcohol intake, follow up on periodic health examination and screening tests. Those are essentially key components into maintaining healthy lifestyle. The first 3 points, actually, it's interesting because there was a recent study published in National Geographic, which looked at 3 different communities, one in Italy, one in Japan, and one in the United States. And they looked at, those 3 communities had the special thing where most people in that community lived on average about 10 years more than the average population. And so they looked at what's special in those communities. And the 3 things that were common to those communities were those 3 top things. So people stayed very busy with their family and friends. They really rated their family and friends as being the most important thing in their lives. And they remained very active, whether it's working in the backyard or enjoying your carpentry work or any kind of activity that you actually make you busy and stay with, and then eating well. So they all had either a local garden that they grew their food in, or they just bought healthy vegetable and fruit and cooked it at their home. And so I think it does merit to actually look at these things and consider it as you're looking at for a healthy lifestyle. And definitely avoiding tobacco and alcohol and excess alcohol is really also another important aspect that we need to emphasize, as they both have detrimental effects on several organ function. Now, my talk is going to be broken up into small segments, so my apologies if I'm going to be flying through them. So the first area that I'd like to address is exercise. And what I mean by exercise is not necessarily the exercise that makes you do bench pressing or lifting, heavy weight. It's essentially a two-component. There is an aerobic and anaerobic exercise. And aerobic exercise is known to have a cardiac protective effect. And then the anaerobic exercise actually is proven to be effective in muscle building and gait training and balance. So we'll just talk about the role of exercise in general and how it, so these are some studies that actually have looked at exercise and its effect on heart disease, on diabetes, blood pressure, muscle function, and other aspects. So in general, actually through randomized studies, exercise have been shown to decrease both the primary and secondary risk factors for coronary artery disease. When I say primary and secondary, if someone does not have a coronary artery disease or heart disease, they are less likely to develop it if they are exercising regularly. Same thing if someone does have a heart disease, they are less likely to deteriorate if they continue on a regular exercise regimen. It's also shown to delay the onset of diabetes and improves glycemic control. So if there is anyone among you today who has diabetes, I recommend that after you have your dinner tonight, take a walk or do a 15-minute brisk walk, and then check your sugar prior to the walk and then after the walk, and you will see about 10-point drop in your, or 20-point drop in your blood sugar. And that's actually a significant drop because it does overall improves the glycemic control, and if you continue on it regularly, it does help diabetes in general and even prevent it from happening. It also enhances muscle function and physical performance in the elderly, and that's in particular resistant type of exercises. So if a person does weightlifting, what I mean by that is lifting about 3 or 4 pounds, no more than 10 pounds at a time, and so a gallon of milk will be sufficient to do that, for 40 minutes a day, a day. Can either break it down into small intervals will be fine. Again, it also reduces the risk of fall and osteoporosis and a fracture. Essentially, if you the specific exercises actually that does that are the ones that concentrate on balance and muscle strengthening, and those are so examples of those kind of exercises like Tai Chi and yoga type of exercises that will help actually in this area. It also found that exercise alleviates depression and enhances mood, and also it does improve cognitive function. The reason it may help in those areas, especially with depression and mood, is because there is a release of endorphin as we are exercising, and that has some mood enhancing effects. So the rules of exercise. I always say, do an exercise that you enjoy. So whether it's swimming, biking, brisk walking, weightlifting, anything that you actually enjoy, that way you will invest the time in doing it. And then also listen to your body. What I mean by listening to your body, if this is your first time going out and exercising, I suggest that you actually probably have a health checkup by your primary care physician just to make sure that you are actually fit to the exercise, and also always start with a very low intensity exercise and build your level of exercise slowly. That's also important. Also, don't go out and just do heavy weightlifting right away, because that could actually cause trauma to your body. And so the current recommendations, essentially, for cardiovascular type of exercise, which we talked about, aerobic type of exercise, it's a moderate 60-minute exercise per day. That could be actually broken down into 10 or 20-minute intervals. So as opposed to doing a 60-minute all at once, you can have it done 20 minutes at a time. The key thing is to raise your heart rate about 60 to 80% of the maximum heart rate. Again, like I said, start slow and go slow. Resistance and balance exercises, as I stated, are essential for prevention and management of osteoporosis, falls, and fractures. Now we're going to switch to diet. So what's a healthy diet? Again, we've all read about the different dietary regimens that are out there. Atkins diet, South Beach diet, low carb, low calorie diet. Really, and then also there is the Mediterranean diet and the modified Mediterranean diet, the vegetarian and the vegan diet, and all those things. And the key thing really is what they all have in common is that essentially you have to eat a rich diet that's rich in fruit and vegetables, whole grains, nuts, and moderate in polysaturated fatty acids and omega-3 fatty acids. Omega-3 fatty acids are proven to be very essential for heart function and also cardioprotective. So, and they are present, someone said in fish oil, but they are also present in guacamole and other things. So definitely, seek them out. Certain nuts also have omega-3 fatty acids. There are also other things. It should be moderate in protein and dairy product and low in carbohydrates. This is a key, because most of us don't realize that when we are drinking that fruit juice or soda, we don't realize, we think it's just a drink, but actually it is saturated with carbohydrate, and it is, I say, the bad carbohydrate. So try to avoid drinking fruit juice and sodas because they are really bad for you. I'd much rather see you eating fruits and vegetables and drinking water. Flavored water will be much better. Also, it's recommended to eat a diet that's low in cholesterol and saturated fatty acids, such as animal fat and fried food. Diet versus supplemental medications. So if you are eating a healthy diet, there is really no necessity for supplemental medications. However, if you're not, I do recommend usually multivitamin with the minerals. Antioxidants, there's been some studies recently that looked at antioxidants actually and found that they may have a detrimental effect if they are taken in a supplemental form as opposed to taken in a dietary form. So if you are eating blueberries, it's great because they are full of antioxidants. But if you take them as supplements, they may actually affect your lipid profile and cardiac health in an adverse way. So be careful. And I do tend to recommend for my patients not to take multivitamins with antioxidants because of that effect. Same thing actually applied to vitamin E, and vitamin E in general also does increase the risk of bleeding, especially if you are on aspirin. So again, be careful with vitamin E supplements. In regard to calcium and vitamin D, if you are so the recommendations at the present is to take about 1,200 milligram of calcium and 400 units of international unit of vitamin D. If you are spending enough time in the sun and you eat a diet that's rich in calcium, so 3 servings per day. What I mean by 3 servings, say 3 different kinds of yogurt, or 1 glass of milk and 2 different kinds of yogurts, or in any combinations, or cheese, then you really don't need to take calcium and vitamin D supplements. And actually, there has been also recent studies that showed calcium is much better metabolized through dietary sources than through supplemental sources. So now we're going to shift gears to weight. It has been also proven recently, or it's been actually, this is a common knowledge, but I guess there has been more recent data to also show this, that maintaining normal weight throughout life and with slight increase in weight as we get older is associated with lower mortality rate. But keep in mind, high BMI, meaning in the obesity range, is actually associated with poorer quality of life and increased morbidity. And obesity itself is associated actually with increased incidence of diabetes, cardiovascular disease, and recently there's been more than 300,000 deaths attributed each year to obesity. So it's a significant problem that we're facing as a nation. Also, weight is associated with increased incidence of cancer. There are so many different cancers that I listed them here, but essentially there is some correlation between weight and cancer. So again, just to keep in mind that excess weight is really detrimental. Now we're going to talk briefly about cognitive function. Again, from recent studies, and I recently attended a conference in San Diego that actually touched on several of these areas. But really, what's been shown to have some effect on cognitive function is having a purpose in life, staying busy with family, friends, and community, and leisure activities. One of the researchers actually said, there is no enough time that you can say, oh, this is enough to spend with family. You could spend as much time as 8 hours a day, and that still be very good. It correlates well with cognitive function. Again, eating healthy, achieving high educational level. That may actually improve neuronal reserve. What I mean by that, again, because you develop more neurons, it is harder for the brain to lose that, even with Alzheimer and mild cognitive impairment. And then maintaining mental exercises. I think part of that is your brain is as plastic as the rest of your body. So if you are going to exercise your muscles, you will develop bigger muscles. If you're going to exercise your brain, you're going to develop bigger brain. So just keep that in mind. Also controlling the risk factors for cognitive function. So dementia is not only Alzheimer's dementia, but there are other areas like vascular dementia. There is Lewy body dementia and other things. But especially with vascular dementia, I think we still don't know very much about it, but I think it's important to control the risk factors for it, which are high blood pressure, high cholesterol, and diabetes. Now we're moving actually to a concept that I thought is important for me to cover because not many people are aware of it, but I think it's important to recognize. So what is a frailty? A frailty essentially is a term used to describe older people who are in an unstable condition, who are at risk of actually developing a lot of adverse outcomes, including institutionalization, disability, falls, and even death. Once a person is at that stage of frailty, there is very little that can be done to reverse it, and in most cases, we end up actually just doing conservative management and basically interventions to prevent further morbidity. So there is also, in those patients, there is a decrease in organ function. In general, heart, kidney, and lungs and liver all are impaired and at risk of failing. So how a person reaches there? In general, a person may develop a heart or a vascular or cardiovascular disease, stroke, or anything related to that. There may be a cognitive decline. There may be loss of muscle mass. Osteoporosis also contribute to it. In all those cases, there is decrease in mobility and endurance. If you see in all cases, it leads to essentially decrease in function. Osteoporosis, sarcopenia lead to hip fracture, lead to decreased function. Cognitive decline could also lead to decreased function. And in general, they all lead to frailty. What I'm hoping to, by introducing this concept, is to emphasize the importance of intervening at this stage. So if a person has cardiovascular disease or any element of cognitive decline, or loss of muscle mass or osteoporosis, is to work really hard at reversing those processes or maintaining them at a steady state to prevent functional decline. Like I said initially, I think functional status is of paramount importance to maintaining health. A person who has good functional status will live much healthier and also much longer, and we see the effect of it day in and day out. So hopefully by intervening early on, we can prevent frailty from happening. So what kind of screening tests a person may get to do some of this work or to prevent some of those problems? This is just the basic screening that we do for the geriatric persons that we see in clinic. So in addition to the general screening tests like lipid and glucose, I tend to actually look for reversible causes of cognitive impairment, such as thyroid hormone. And then vitamin D, I tend to also check it because I think it not only affects the bone health, but also affects muscle function and neuronal function. So those are, I put a question mark against PSA because there is a lot of controversy about it right now in the literature. Again, keep in mind this is a basic list, so if you have diabetes or heart disease or any kind of lipid abnormalities, there are a lot more testing that need to be done beside those ones. When it comes to cancer screening, I wanted to emphasize the importance of making that decision individualized to your particular case or your loved one's particular case. So we all have seen the guidelines probably and read the conflicting evidence between the American Cancer Society and the American College of Physicians and the American Gastroenterology, and they all have their own way of determining at what age should be, we should make the cutoff for a certain or a particular screening test. What I want to emphasize really is that you just have to look at your case and make it case specific. So look at the risk of dying from that particular cancer, about the benefit of the screening test that you will get, the harms that you may get from the screening test, and also your own values and preferences. So for example, if you take PSA, which we talked about initially, it's very controversial because an 80-year-old person who is healthy, who doesn't have any problem with prostate or not symptomatic, comes in and asks for a PSA check. Now, if I'm going to check the PSA and it's going to be 10 or 15, we're going to have to go the next step, which includes getting a biopsy to diagnose if they have cancer or not. The biopsy by itself is very morbid. A lot of the men in this audience who've had the biopsy will know that it was not the most benign procedure that was done. And with that, we may find cancer. Now, if I find a cancer, a prostate cancer, in an 80-year-old man who is completely asymptomatic, the value actually of treating that cancer is very controversial. Because on average, statistically speaking, there is about 50% chance that an 80-year-old person will have a prostate cancer and will die with that cancer, not from that cancer. So now, if we're going to intervene and do a total or radical prostatectomy, removing the entire prostate, it will put that person at a much higher state of morbidity because they may develop urinary incontinence or other uncomfortable symptoms. And so what we did essentially is we found a cancer that may not be the one that will kill that person, but we took it out and we put that person at a state of much higher morbidity. And so I'm not sure if that was really the most, the right decision to make at that point. But, so that's something to keep in mind when you are pursuing a screening test, is how much benefit are you getting from that screening test? And what's the morbidity that comes with it? So now we switch gears to medications. Again, I wanted to emphasize the importance of or the effect of aging on medication metabolism. As we get older, our body composition changes. So we tend to have more fat than water because we lose the muscle mass, so we lose water with it. And with that, we actually retain medications longer in our body. And so that's where the effect of volume distribution increases. So we retain them longer. Also, there is a decline in liver and kidney functions, which are the major areas for clearance of those medications. So with that, again, we do retain those medications for longer. So keep that in mind when you are taking, especially medications that actually have some effect on our cognition, like benzodiazepines, like sleeping pills, pain medications, because they tend to have a stronger effect in elderly compared to the younger population. Again, with increasing age, there is increased chance of being on more than 3 medications at a time. And so the chance of drug-drug interactions does increase. Now, I'm not going to recommend that if you are on 5 or 6 medications to stop them, because some of you may really have to be on those medications for cardioprotective effect or for diabetes and other things, and the benefit of being on those medications outweigh any benefit of stopping them. But just keep in mind that always, so keep in mind, general rule, always review your medication list with your doctor, and always keep that list with you. It's a key thing to know what the name of your medications are. So don't just remember that I take the red pill and the white diamond-shaped pill, because most of the time I will not know what the red pill means or the white diamond-shaped pill means. So it's really, really important just to keep that list with you at all times. Also, I include with the medication list herbal and over-the-counter medications, because a lot of us don't look at those as having any medicinal value, but they do, and they do interact with a lot of the medications that we take. That's also very, very true if you are taking something like Coumadin, a blood thinner, which does have a lot of interactions with so many herbs and medications and food items. That's very true also for statins and also for other medications like amiodarone. The list goes on, but you got the idea. Now we're going to shift gears to home safety. And what I mean by home safety is, so you have that lovely elderly person, your grandpa or grandma with you at home, or your husband or wife, and want to make home as safe as possible. The key things is to address the disabling conditions that could make the environment unsafe. And when I say that is really try to make sure that you're managing urinary stool incontinence. If a person has arthritis, any gait instability, if they've fallen in the past, is to make sure that that's been addressed by their primary caregiver, that the home is made safer by getting physical therapists out to the home and making sure that rug is out of the way, that table is out of the way, and that a person can use a walker, for example, or a cane while they're ambulating around the house. It's also very important to maintain the functional status of a person. Again, going back to the functional status, I can't stress how important that is. So a person who has dementia does not mean they are unable to exercise. It's actually really, really important to get that person out of the house at least 40 minutes a day, 5 days a week, and get them to walk and do simple exercise, because that's really important in maintaining their functional status. The last thing you want to do is to have that person sitting at home and watching TV, or sleeping for that matter. And then always consult with your physician. So we can actually easily send a team of physical therapists and occupational therapists to your home, and that probably will be covered under your insurance, especially if the person has Medicare, which most of the elderly population does. And they can do a lot. They can actually make recommendations about getting adjustable toilet seats, bathroom bars, etc. So, and then, like I said, maintaining independence. So maintaining exercise, muscle strength, that's also very, very important. Preventing and managing osteoporosis, as we talked about earlier, using assisted devices when needed, like a walker, a cane. And if you are a person who's living alone, it's really important to get something like Lifeline, because that will make you safe and be connected. And also reach for the community. There is a lot of services out there, like outreach, Meals on Wheels, etc. So don't hesitate to talk to your primary care physician about those services, because they're out there for you. So in summary, successful aging can be achieved by adequate exercise, diets, and healthy lifestyle, maintaining friends, family close, and by indulging in frequent leisure activities and controlling chronic disease processes. I thank you all for your patience and for listening, and I will entertain your questions. That's a great question. I don't really know why, but there's been several studies now out there that actually showed they may have a detrimental effect on lipid profile. And one major study that I can quote was done in patients who have already coronary artery disease, who were on lipid lowering medications like statins and actually taking niacin, which is another vitamin supplement. And it shows that those patients who were on the 3 agents, statin, niacin, and antioxidants, did much poorer than the ones, or poorer than the ones who were on niacin and statin combination. The one who were on niacin and statin did significantly better. So that was in secondary outcomes. Now, in primary outcomes, there's been also several studies in younger patients. There may be increased risk of bleeding, increased risk of mostly really bleeding that were looked at and things like that. So that's why I tend to shy actually from recommending antioxidants as supplement. And the reason for that, and this is all speculation, may be the fact that we are in a form of supplement, you take them at a much larger dose than when you take them in a form of dietary way, like fruits and vegetables. So. That's actually a very good question. So I take back the age. At the present time, believe it or not, actually we don't recommend PSA to any age group. As a matter of fact, there's been a recent study that showed there is no correlation between PSA and prostate cancer. So if I check a 50-year-old non-PSA and their PSA comes to be 1.2, that doesn't mean they don't have a prostate cancer. On the contrary, they actually certainly could have it. So there has been no correlation because that was done on people in a randomized study where they looked at the PSA level and the volunteers who volunteered to have a biopsy done, and they found that people with a very low PSA still had prostate cancer. So at the present, we actually don't recommend PSA screening for prostate cancer. No, that's another really good question. So every time we prescribe a medication, we do look at the benefit and the risk from the medication. And hopefully when we do prescribe a medication because we determine that the benefit outweighs the risk. However, there is always a risk when you are taking a medication. So one medication that will help, for example, your blood pressure may have a detrimental effect on the kidney function. What we try to do to minimize that effect is by having you be screened periodically to make sure that you don't develop the side effects or the unwanted effects of that medication. So if a medication does have an effect on the kidney function, we do check kidney function at a much more frequent rate than an average person who is not on any medication, just to make sure that that side effect will not happen. Same thing with statins, for example. We look at the liver function constantly because we do know that they may affect liver function in the long term. By the way, Tylenol is also one of those medications that we tend to think about it as being a benign medicine, but recently it's been also shown that it has a cumulative effect on the liver, so not only an instant effect. We know if you take more than 4 grams a day, for example, if you're not drinking, that's the maximum limit, but also in the long run, if you're taking it every day, it does have a cumulative effect. So people who are on certain medications, we tend to screen them more frequent to make sure that they don't have the side effect that is generated usually by that medicine. It's not been proven. There is a lot of theoretical data about ginkgo biloba. So it does help with cerebral perfusion. People who take it, they say they do actually have some improvement in their mood, but those are anecdotal, and there has not been a randomized controlled trial. I mean by that, taking people who are on ginkgo biloba and comparing them to one who are not taking it, that's shown a benefit. I don't have anything per se against it, but make sure that if you are on other medications is to have it run across, because to make sure that there is no drug-drug interaction, especially if a person is on antidepressant, for example, it does potentiate their effect and may actually potentiate also the side effect. So keep that in mind anytime you are taking any supplemental medication.
The preceding program was brought to you by Stanford on iTunes U and is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at itunes.stanford.edu.